Sciatica is defined by a radiating line of pain. It travels from the lower back, deep through the glutes, and straight down the leg. This path follows the sciatic nerve, the largest and longest nerve in the human body, serving as a primary anchor for the posterior chain. Standard biomedicine often frames this as a mechanical failure, such as a slipped disc or muscle tension physically compressing the nerve. Traditional Chinese medicine views this pain as a manifestation of systemic disharmony. It signals a blockage in the flow of qi and blood through the meridians of the lower back and leg. In this clinical framework, the radiating discomfort serves as a diagnostic marker for a larger flow pathology. The specific location and nature of the pain reveal where the internal network has collapsed across the lower body. The bedrock axiom of traditional medicine: where there is pain, there is no free flow. Where there is no free flow, there is pain. Healthy function depends on the continuous, unobstructed circulation of vital energy, or qi, alongside physical blood. This circulation travels through meridians, specific energetic channels that form an intricate transit network mapping the entire body. When obstructions or deficiencies occur in these channels, they deprive the sciatic nerve of the circulation required to maintain healthy function. Treating sciatica effectively requires repairing the circulation across this entire network, rather than focusing solely on the site of the pain. We must map 4 primary meridians over the sciatic nerve. The bladder meridian runs down the posterior leg, mirroring classic pain. The gallbladder meridian follows the lateral side. The governing vessel regulates the spine, while the deeper kidney meridian provides foundational support. This historical mapping shows how these channels have been utilized for centuries. Along them sit specific intervention nodes, acupoints like BL23 on the lower back, GB30 at the hip, and KI3 at the ankle, used to restore circulation. Identifying the exact path the pain follows allows the practitioner to determine which meridian channel has experienced the failure. Through pattern differentiation, practitioners isolate the blockage's cause. Pattern 1 is wind-cold-damp obstruction, occurring when environmental pathogens invade the channels, causing a heavy, stiff sensation. This pain spikes during cold or damp weather, finding temporary relief when heat is applied. The second etiology is heat in the channels, presenting as sharp, burning pain. Pattern 3 is qi and blood stagnation, indicating a localized drop in circulation that leads to stabbing pain in fixed locations. This specific stagnation-based pain often intensifies late at night and can produce irregular sensory feelings, such as tingling. The final pattern is kidney yang deficiency. This represents a foundational weakness rather than an active blockage, causing a chronic dull ache and weak knees. While the localized symptom of sciatica is identical in all 4 cases, these underlying mechanics demand entirely different clinical treatments. In the clinic, this theory translates into physical interventions designed to restore the flow of qi and blood. Acupuncture needles are inserted directly into targeted acupoints. This mechanically unblocks the channels to relieve pressure on the nerve. Herbal medicine addresses the biochemistry of the condition. Custom formulations are measured to expel pathogens, reduce inflammation, and invigorate blood flow. Manual therapies like gua sha and tuina are used to physically release the fascial and muscle tension that can bind the nerve pathways. For deficiency or cold patterns, practitioners use moxibustion. This applies targeted thermal therapy to warm the channels and strengthen the kidney yang. TCM avoids a one-size-fits-all approach to pain. It instead deploys specific tools to repair the exact failure point in the patient's biological network. Maintaining these clinical results requires daily self-care to prevent stagnation from returning. Keep the lower back warm, avoid cold, damp environments, and consume warm, cooked foods to protect the body's internal heat. Self-care also extends to managing stress. Because stress triggers the qi stagnation pattern we analyzed earlier, high-tension environments directly compromise the physical flow required for recovery. Patients must seek immediate professional biomedical evaluation if pain is accompanied by severe numbness, weakness, or difficulty walking. By identifying the pathological pattern and clearing the channel, traditional Chinese medicine addresses the root cause of the pain. When the balance of the internal network is restored, the body can heal from within.